Welcome, bonjour, to the Hub's first open webinar. Thank you for joining. You are among over, these numbers keep ticking up, over 155 who've registered, most with affiliations, past or present, from national, regional, provincial, territorial, and community organizations, working in mental health, public health, education, child and youth services, and more, with the biggest draws from the federal government, Public Health Agency of Canada, and Health Canada, and the Mental Health Promotion Innovation Fund community. We gather today in a spirit of collaboration, of community, of reconciliation, the importance of this stance reinforced by news this past weekend out of Kamloops, BC. We acknowledge the Indigenous peoples of the lands all of us are on today and the ongoing traumas of colonization. I'm Barb Riley, Scientific Director for the Knowledge Development and Exchange, KDE Hub, and heartened by the interest in mental health promotion. It's a young field, not well understood, and desperately needed. The Hub, to our knowledge, is the only national entity with a single focus on mental health promotion. Part of the mandate is to build a community of shared interests to help strengthen mental health promotion in Canada. Now, this is tricky since the work of mental health promotion is done by many, let me say amazing, people and organizations who don't necessarily think about their work as mental health promotion. I think about this as coming at it through a back door. Their front door may be addressing food insecurity, poverty, homelessness, racism, discrimination, or promoting green space, outdoor play, youth empowerment, healthy public policy, truth and reconciliation. All these doors and more promote mental health by helping to create the conditions for positive and strong mental health among individuals and within communities and broader systems. Now, the Hub enters the field through a front door with mental health promotion in our name and our mandate. We were established by the Mental Health Promotion Innovation Fund, and we support the 20 projects funded through this program and others, like many on this webinar, with shared interests. Each of you came here today through some door, and I'd like to say every door has a welcome sign on it. Although you're not meeting and mingling, just imagine yourselves rubbing shoulders with others who are interested in, or at least curious about, mental health promotion, maybe learning something new, reinforcing things you already know, making connections to your world, simply acknowledging this is something you care about. Most important is your presence and trusting your choice and instincts that had you sign up in the first place. Our goal in this short time together is to literally paint a picture of what mental health promotion is all about and to consider how to improve it. This webinar is only one input of a growing set by ourselves and many others that aim to spotlight mental health promotion and consider how to advance the field in Canada. So the Hub takes what we call a suite approach, spelled both ways, I like to think, to its supports. On the topic of strengthening mental health promotion in Canada, this slide shows a few of our supports. Our first annual symposium this past January was all about context for mental health promotion. A few relevant sessions are listed on the slide and can be accessed on our website. We recently posted a blog on how strengthening Canada's response to the pandemic also means strengthening mental health promotion. It includes as well a sampling of definitions of mental health promotion. Our most recent Hub update, the May edition, put a spotlight on the promotion end of the mental health continuum. We also have a few resources about the field in general on our website. All are part of an ongoing dialogue and seeking to provide as many entry points or doors as possible. So I mentioned painting a picture of mental health promotion. To do this, we'll start local and build to global, hearing from 3 speakers, each for up to 10 minutes, and there will be a question and answer period that follows the presentations. So the three speakers are myself, followed by Shannon Bradley Dexter, and then Emily Jenkins. I can't help but smile when I mention these two. Our affiliations most relevant to today's topic are listed on the slide. We'll each speak from these perspectives. Myself, knowledge development and exchange for the Innovation Fund projects and beyond, federal funder and lead for KDE within the Innovation Fund to Shannon, and then Emily as a researcher, Innovation Fund project lead, and lead author on the global position statement for mental health promotion. So please, I invite you to consider these perspectives in questions that you may ask us. As questions come to you, please post them through the Q&A function in either French or English. Although we're speaking in English throughout the webinar, questions will be answered in both languages and during or following the webinar. So my job from a KDE perspective is to describe the most local of the MHPIF, or the Mental Health Promotion Innovation Fund, what is happening in communities across the country, and to do so in a way that's both accessible and informative. So I said we would try to paint a picture. I'll do that by using new products from the Hub. We recently posted infographics for all 20 projects on our website. These were produced in collaboration with the projects. Not yet posted on our website is a short video I will share now. The video will orient you to the set of infographics and truly, hopefully, a picture of what's happening across the country. The picture is complemented by some awesome audio. It's Eric, one of our Hub's implementation managers. So now we'll launch the video.
Imagine Canada as a world leader in child and youth mental health promotion. We are actively addressing upstream determinants of mental health in ways that are evidence-informed, sensitive to contexts, sensitive to cultures, equitable, and sustainable. The Public Health Agency of Canada's Mental Health Promotion Innovation Fund is helping to achieve this vision with support from us, a new knowledge hub funded through the program. At the heart of the Innovation Fund is a diverse set of projects, 20 of them, that are designing, testing, and implementing on a small scale first, and then scaling approaches that are the most promising. What needs are the projects addressing? Who are they serving? With what approaches? Where are they taking place? What difference do they hope to make? Answers to these questions help us understand what difference the Innovation Fund can make in Canada through the funded projects and what we can learn from them. You can find answers to questions about the who, what, where, why, and how of projects in a set of infographics co-designed by ourselves, the Innovation Fund's KDE Hub, and the projects. While each project is unique, and their strength is in this diversity, they share some features too. Projects serve several populations: Indigenous and Northern Indigenous youth, newcomer, immigrant, and refugee families, newborns, infants, families and caregivers, school-aged children and youth, young adults, and those who identify with LGBTQ2S+ communities. Projects use different approaches such as arts-based, land-based learning, trauma-informed, youth-led, policy focus, and strengths-based. They are in over 120 intervention sites across the country, in schools, in a variety of community settings, in person and virtual. And all projects aim to improve determinants of mental health amongst individuals, families, communities, and over time, policy and systems more broadly. We invite you to explore the infographics, the full set, or those that align most strongly with your interests, and connect with us, work with us, to help make Canada a world leader in mental health promotion.
So that's the unveiling of the short video. That's an orientation to the 20 projects across the country that are funded through the Innovation Fund. And as the video mentioned, they're located in over 120 sites. So the 20 projects, but many, many, many more locations. And each is unique, and yet they are all united in their focus on mental health promotion. The combination of this shared focus and their diversity is what supports rich learning about promising approaches and how to do mental health promotion in diverse Canadian contexts. So in the video, you also heard about some of the diversity and clusters of similarity across projects, populations they're working with, approaches they're using, settings in which they're taking place, and what changes they hope to make at individual, community, and structural levels. These dimensions are actually the essence of mental health promotion and help to define what it is. The 20 projects are local assets across Canada. Shannon will describe the national program that brought them together and prompt us to think about how we might leverage the Innovation Fund for advancing mental health promotion in Canada. Over to you, Shannon.
Great, thank you, Barb. I really appreciate that video, and I'm going to make a few comments about that today, but this is my first time seeing it, and it's an excellent overview of how the Mental Health Promotion Innovation Fund supports projects for mental health promotion. So I'm Shannon Bradley Dexter, and I've been working with this funding program for over 10 years. And I would like to start by thanking the Coast Salish people, specifically the Squamish Nation and Tsleil-Waututh Nation, where I reside, whose traditional territory North Vancouver resides on. I really value the opportunity to live and learn and raise my children on this traditional territory. And as Barb acknowledged, I do want to make note of the 215 children who were discovered this weekend in Kamloops. And I thought a lot about them over this weekend. And of course, my prayers are with them and the impact of trauma from residential schools as this continues. And over 50% of our projects support First Nation, Métis, and Inuit and Indigenous families and communities. And we have 3 Indigenous-led organizations that are supported through the Innovation Fund. And there are really a variety of worldviews that are supported through this funding program, cultural models, and ways of knowing. And of course, this is of central importance to a funding program that is focused on mental health promotion. And I'll highlight some of that in my brief talk today. So I'm really happy that you're here, and thank you to Barb and the KDE Hub for inviting me to share some of the proven approaches for a funding program focused on mental health promotion and for community-based projects. So the pandemic has certainly brought us many challenges and opportunities in the ways that we adapt and improve and move through recovery for mental health promotion. And you will see on the KDE Hub website, they have worked on a pandemic adaptation study. And I really encourage you to access the resources that are on the website and join in future events like this. And I know, like, we have a wide variety of people here. So there are policymakers, students, other funding programs, program developers, and practitioners. And feel free to use the elements that I'm speaking to today. And of course, any of the resources and evidence on the KDE Hub website. And please, connect with Barb and her team to add your own, because this is really the opportunity for us to move the mental health promotion agenda forward. So today, if we can move to the next slide, please. I wanted to provide a brief overview of how this funding program operates, what mental health promotion means to the fund, and outline some of the key elements of this strategic funding model, and then just talk about how you can stay connected to this work through the KDE Hub. So the next slide, please. So you really saw in the video, that was an excellent overview of how our funding program works to support projects. But there really are 2 objectives for the Mental Health Promotion Innovation Fund. The first is to test and fund community-based projects to deliver mental health promotion and to provide funding for research and evaluation. And that leads to the second objective, because the second objective is to take the new knowledge that's learned from this research and share it with other practitioners, policymakers, and implementers so that broader systemic change can occur. And we strive for a culture of continuous improvement at the Innovation Fund, and with reflection that can continue to create a program that's responsive and evolving to the realities of individuals and communities in Canada. So this funding program is unique, and it does support individual communities to really tailor the intervention for their participants and populations. And at the same time, there's funding to address those broader social determinants of health. So what does this really mean? And as you can see in this picture, the first box in red is where there's a program or funding program where everyone is receiving the same amount of supports. The second picture speaks to equity, where those supports are given to those who need it. And in the final picture, of course, if you address the barrier that's there in the first place, each person can now succeed without the supports. And there's a longer term sustainable change for health promotion. So some of the social determinants of health were highlighted in that video, but what does that mean? We're really speaking to making the healthy choice the easy choice, ensuring that people have access to express their culture, their identity, to be able to attend schools and to live life free from discrimination and racism. These are just some of the examples of the structures that influence our life. So if we can move to the next slide, please. Briefly, I want to highlight mental health promotion and the way that it is approached through this funding program. There's an emphasis on strengthening protective factors for good mental health and enabling access to skills, resources, supportive environments that enhance equity and keep individuals and populations mentally healthy. So protective factors, what are those? What does that mean? If we can move to the next slide, a protective factor is something that enhances our well-being and builds our quality of life across our life course. And it really supports us and helps to prevent or reduce vulnerability for the development of disease or illness. And these are two examples of models that that outline protective factors across the life course. And in our first phase of funding, applicants were supported and able to use any type of model that fit their community. And here we have the First Nations Mental Wellness Continuum Framework and the Indigenous Wellness Framework. If we can move to the next slide, this is an overview of protective factors across life stages. And this is also linked to the broader social determinants of health as identified by the Chief Public Health Officer, the Public Health Agency of Canada. So if we can go on to the next slide, I'll just show you the kind of guiding, the way that our funding program is designed. These elements kind of guide and enable this work to occur and to be created at the local level. So from our funding program, we look to ensure that there's multi-level action, that the intervention is working in multiple levels from individual, family, and community, that there's vested partnership development. And this is really key to be able to work across sectors and of course, ultimately across provinces and territories. And by vested, this is a term that refers to kind of fewer partners, deeper, meaningful partnerships with a common agenda to approach this change and policy impact that's required to address the social determinants of health. The funding is up to 3 years, as was outlined briefly in the video you saw. So by the time projects were operating in third phase in this last round of funding, most were national and all were working to affect impact through systems change and scale. We have the emphasis on knowledge development and the new knowledge to be shared to impact future decisions. And of course, a real study on scale and the importance of understanding context in new communities when the community project is expanded, and also understanding the scale through systems and how to make those changes. And across all of these pieces, we really want to be an incubator for new ideas and constant improvement, and this spirit of continuous learning, which happens through these types of exchanges. So in the next slide, I've just included the kind of overlaying elements of projects. So how do these higher level funding programs, how does this approach get translated on the ground? So you'll have this here. And in the next slide, just very briefly, as I mentioned, this is a funding program that is based on results from a previous run called the Innovation Strategy, which funded both mental health community projects and achieving healthy weights across Canada. And in that final phase of funding, like, we did learn that 90% of the projects did make impacts in social determinants of health, and in that realm that creates long-term sustainable change for health promotion. So on the final slide, some of our broader program goals are really to continue to build this momentum for mental health and to contribute to the national understanding of how we do this work, and also internationally. So with that, on my last slide, if you want to learn more about our program, that we have information on our website. And coming soon, we will have a special issue published through the Canadian Journal of Public Health that is focused on the Public Health Agency's innovation strategy. So there'll be more detailed information available as well. So with that, I'd like to pass it over to Emily, who's going to speak about the global statement, international statement that she's worked on for mental health promotion. Thank you.
Thanks, Shannon, and hi, everyone. Good morning or good afternoon, depending on where you're joining from. I'd like to start by acknowledging that I'm joining from UBC, which is situated on the traditional and unceded territory of the Musqueam peoples. I'm excited to join today and contribute to discussion and bring a focus to global contributions to the field of mental health promotion. As has been described so far today, mental health promotion is not a new concept and actually has been around for several decades. And since this time, there's been ongoing calls from mental health advocates to better integrate mental health promotion into an overall population approach to mental health, one that's oriented to strengthen good mental health and to prevent and treat mental ill health. However, despite this advocacy, mental health promotion remains an early field. Some may say it's still in its infancy, and the realization of a population approach to mental health has yet to be widely achieved. Sorry, I'm just going to make sure. Could you advance the slides a couple of, yeah, to the one more. Thank you. So recognizing these gaps, in June 2020, mental health promotion scholars and practitioners from around the globe convened as part of the International Union for Health Promotion and Education to form a global working group on mental health promotion. The global working group was initiated by Professor Margaret Berry, who's head of the World Health Organization Collaborating Center for Health Promotion Research and a professor at the National University of Ireland, Galway. Membership in the Global Working Group has been geographically diverse and currently includes representation from Ireland, Britain, New Zealand, Australia, Croatia, Finland, Brazil, and Germany. And if you could turn to the next slide. Early on in our collective work, we recognized that the current context, which included the COVID-19 pandemic and growing awareness about structural racism, concerns about the climate crisis, and instances of police brutality were intersecting to contribute to adverse population mental health impacts globally. Next slide, please. We also recognize that as a result, there was a policy window born from new understandings and awareness among the public about mental health, including the ways that our everyday conditions, also referred to as the social and structural determinants of mental health, influence our mental health at a population level. Next slide. For example, within the context of the pandemic, mental health has been heavily impacted by economic downturn, unemployment, experiences of violence, poverty, race, gender, and loss of childcare, to name a few. These impacts are not distributed equally and are leading to widening mental health inequities. Mental health promotion provides an orientation for responding to these challenges in a way that holds the potential to benefit everyone, while also redressing the harmful conditions that cause worse outcomes for some. Next slide, please. To leverage this opportunity, we decided to issue a position paper, a statement on the critical actions for mental health promotion, and to situate mental health promotion within a population approach to mental health in an effort to guide pandemic recovery plans in our respective country contexts and globally. In Canada, for example, I've used the position statement to initiate discussions about mental health promotion within provincial and federal government agencies, and not just those focused on health. A mental health promotion response will require multi-sectoral collaboration to address varied and intersecting determinants of mental health. While still a new field, there is a strong evidence base that we can use to guide the investments that we make into mental health promotion. In our position statement, we highlight 8 priorities for mental health promotion that are grounded in science. And if you could advance the slide. So these include initiatives to promote infant and maternal mental health, to cultivate child and adolescent mental health and well-being, to implement parenting and family strengthening programs, to support mentally healthy workplaces, to initiate community empowerment programs, incorporate mental health promotion within existing health services, to enhance public awareness of different ways of promoting mental health and reducing stigma associated with mental ill health, and to adopt a mental health in all policies approach, which really centers on enhancing equity and social justice. And if you could go to the next slide, please. In addition to the position statement, subgroups of the Global Working Group are coming together to construct an advocacy framework, which would be focused on trying to enhance the uptake and implementation of mental health promotion globally, a community of practice to establish key competencies and educational requirements to further build the mental health promotion workforce, and webinars and conferences to support learning and capacity development. Next slide, please. And so just as I'm concluding my portion of the presentation, I want to put out there that we would love for others to join us in these efforts by sharing the position statement and amplifying the message that investment into mental health promotion as part of a comprehensive population approach to mental health is needed now more than ever. And so we would love to connect with people who are interested in taking this message forward and working at your various levels to try and make this happen after many decades of advocacy. So thank you.
Fantastic, Emily. Thank you very much to both Shannon and Emily. And woohoo, look at this. We have some good time for some discussion, dialogue between the speakers, questions coming in from many of you on the call. So a few questions have come in with both registrations and also during the webinar so far. They're just being fed to me and I hope I pick up on them. A few of you have asked if the presentations will be available afterwards. Of course, that's a definite yes. Hub standard practice is actually to provide what we call an event brief for anything that we offer, any supports and services. And for this first open webinar, it'll include the presentations, the link to the recording, links that are offered in chat, and also just a brief description, main messages that emerge during the webinar, and that will be in both official languages. So a definite yes to materials being available after today. So one of the questions that came in registration was how are Indigenous, marginalized, BIPOC, and other intersectional voices being considered when discussing mental health promotion in Canada? Now for this question, I'm going to maybe punt this to Shannon and see if it's something that you would like to comment on first.
Great, thank you, Barb. And yeah, thank you for this question. So I think one of the perhaps foundational pieces is that a mental health and health promotion approach is really explicitly oriented towards addressing issues of equity. And this work includes dismantling the structural barriers to good health, including structural racism. And when we were doing the planning for this funding program, we had quite a few discussions with national Indigenous organizations, including Métis Nation a Thunderbird Partnership Foundation, and the Inuit Taprit Kanatami, just as examples. And so much of what we heard consistently through that dialogue was that it was important to reflect the language that had already been developed by these groups for wellness models, and to ensure that cultural expression and identity is really kind of like a key cornerstone of any intervention developed. And as I noted, the way that this funding program is set up is that it supports communities to identify their own types of projects and interventions that are most suited for their organizations. And through this, I think we have been able to have 3 organizations that are Indigenous-led funded through this program, as well as over 50% of our participants come from First Nation, Inuit, and Métis backgrounds. So this is a really central piece in our funding program. And I know across FAC, there are other funding programs, and in particular, recently there's a new funding program for the mental health of Black Canadians. And that the foundational piece for this work was to set up a multidisciplinary team that came from diverse Black communities across Canada, and they gathered experts together in research, practice, and policy. And this working group provides ongoing recommendations to this fund. And more information can be found on the Public Health Agency of Canada's website, of course, but it is looking right now to date. I think there are 16 funded communities funded right now through this fund, and they will be additional projects will be added through to 2021. So I encourage you to look at that website, and of course, connect with us with any other questions around this. Thank you.
Okay, that's awesome, Shannon. And, you know, it just reminded me too, when you mentioned the mental health promotion for Black Canadians, that in fact, both the Innovation Fund and that program were announced together back in September 2020. So just a little bit of a connection there. I wonder, Emily, I know this is something you're very passionate about, both at a local level and also, I mean, because you have a mix of experiences here, lead for a local project and also the global perspective. Is there anything that you want to add about addressing such diverse communities for mental health promotion?
Well, I guess I would just say that it provides the opportunity to work with diverse communities in our local context to make sure that the types of interventions that we are working to develop reflect the needs of those communities in a way that's going to be impactful, that will resonate with them, that we can work in partnership with people. And so, for example, in the project that I lead, we have diverse representation of young people that we specifically or intentionally work with in refining the intervention to make sure that it holds applicability broadly as we work to further scale and refine the intervention.
Okay, so another question that came in is, and actually, questions that came in. I mean, the general question is about how do I get more involved? So one question that came in through registration was, how can students and recent graduates looking to get more involved with the Innovation Fund do so if possible? And as I say, that's come in through the Q&A function today as well. So this is actually a really common question, you know, just generally about how to get involved, which is ACEs, which is awesome. And I mean, in general, I'm going to go back to my opening remarks. Like there's no wrong door for making connections. And like this webinar and, you know, the other sort of suite of supports are ways for doing this. One of the things, I mean, the hub is still relatively new, and we're actually starting now to broker some graduate student practicums, for example, with with ourselves and also with some of the projects. So, you know, we can absolutely be reached through our website, and we're willing to, you know, play a brokering role and you know, have some dialogue with you about what it means to get involved. We can be reached at KDE Hub at uwaterloo.ca. There's also direct contact with projects. You know, that's another door. Contact information for the projects is on the infographics and lots on our website as well. And of course, looking through and seeing which ones may be local for you and may be of most interest as well. One question did come up today and fed to me about, can you spend more time on describing the local projects? I mean, to do justice to all 20, I mean, really the invitation through today's dialogue and presentations is to really invite you to explore those infographics in particular on the website. They go beyond the kind of written descriptions that are up there on the website, and just to give that sort of thumbnail sketch, but hopefully in a little bit more engaging way. So we really invite you with the overview that's been provided today to really get a sense of where are they, what ones may be of most interest to you, be it through populations, settings, etc., and and make some contact. So I would say, Emily and Shannon, you may have different perspectives on this. So Emily, I wonder with you, is there anything that you'd want to add from probably mostly from a project perspective?
Sure. I guess I would just say that we have several students who are involved in our project and actually key in the implementation of the work, because we're focused on young people and their experiences of the intervention and mental health promotion. We really want to make sure that we're working with other young people to deliver that intervention and to refine it. And so the students that we work with are really helpful in helping to achieve that goal and make sure that the face of the intervention is also young, that they serve in a mentorship capacity, and that the youth who we work with in communities feel like they have people that they can relate to.
So Emily, what are you saying? Our face is not young enough? Totally get it. Shannon, is there anything you'd want to add from a federal government perspective?
Yeah, well, thanks, Barb. Look, I do think for everyone here, like the window that's open is through the KDE Hub. So looking at their resources, connecting with the team, staying on the, now you'll be a part ideally of the monthly newsletter that's circulated. So you can look at some of the blogs, and some of the presentations that might be coming up. And those are things that myself and the members of my team also participate in as well. And I think, yeah, there is a lot of interest in really understanding what these community-based projects are doing. So Barb, I think this sounds like your next webinar, right? To get some of the projects involved and to be able to share some of the work that's happening. So yeah, thank you for connecting today.
Absolutely. It is really important too. I mean, there's, it's always a question of breadth and depth, right? And there's such depth. I mean, there could be a separate webinar in every single one of the projects happening across the country. So another question that came in through registrations, it's actually more of a comment, but I do want to pick up on it and acknowledge it. Says it's from an occupational therapist. And it says that, I would absolutely love for this session to include occupational therapists as useful and recommended healthcare professionals in mental health. And for me, this comment really speaks to allied health professionals and mental health, and 100% agree that many professions, including OTs, have important roles to play in mental health promotion. And so do organizations, again, like I said at the beginning, that may not have an explicit focus on mental health promotion. It's sort of coming in through back or side doors, be it municipal governments, schools, community sports, recreation facilities, groups that focus on housing, healthy public policy, food banks, education, transportation. It really is quite diverse. Emily, it speaks to your point about sort of health in all policies, but it really is quite widespread within society. So, I mean, from my perspective, I guess one other point about this, and it's all about sort of how we see ourselves in relation to any field and enterprise. I think something that's really important is that no one is asked to change their mandate and to change their goals and say, oh, we have to be exclusively focused on mental health promotion. It's really you know, to help all of us build our understanding about what is mental health promotion and allow everybody as an individual, as a representative from an organization and place to better understand how what you do can help create the conditions sort of for or against positive mental health. And that can appear in professional guidelines, in, you know, practice in municipal planning, et cetera. So, you know, one of the things I thought about with this is, I mean, we've got impact assessments, environmental assessments, you know, let's think about as we emerge from the pandemic, what about mental health assessments? I mean, it's that widespread within society. So a little bit more of a commentary on that, but I think that, you know, it really is important that we don't consider needing to come through the front door of I'm all about mental health promotion in order to be part of the community. Shannon or Emily, anything to add to that?
Well, it's you know, a specific profession, OT, but you know, in a way, a lot of what occupational therapists do could be considered mental health promotion in the sense that they help people to have meaningful work and employment and to be able to carry out their everyday needs or their activities of daily living. And so in that way really is promoting capacity for people to live with you know, the very best quality of life, which is so integral to their mental health.
Okay. So just on this theme, I mean, you know, the specific question was from an occupational therapist, and thank you for that. I guess one of the things I wonder, you know, Emily and Shannon, whether you might have a perspective on this too, is what are it, you know, from your sort of, you know, place in the field and rich experience, what are other doors perhaps for entering the field of mental health promotion? I mean, as you're, you know, sort of pondering that, I'm reminded even within the hub, we have what's called a hub resource collaborative. And that group is a set of research and practice leaders from, you know, across the country that provide quite diverse perspectives on the work of the hub and the development of mental health promotion more generally. And I even think about the diverse perspectives that are in the different doors people have come through. There's social work, healthy public policy, determinants of health, school mental health. Emily, you'll love this one, nursing. So there's, again, those are different doors. I just wonder if either of you have any thoughts on other doors that, you know, are more than ajar, are ready to open for entering the field of mental health promotion.
Well, and this is where maybe I'll make a comment. This is where I think that using things like resources like the position statement and leveraging the Mental Health Promotion Innovation Fund and the hub, which is supporting the projects, to be able to amplify the message around what mental health promotion is and help to enhance understanding among the general public about this particular orientation, because as you mentioned, it's kind of everywhere. And I think a lot of people are doing mental health promotion, perhaps without necessarily recognizing it as such. But I think as we bring further awareness to that, we can work more intentionally together and across sectors to be able to make the types of impact that we want to make.
Shannon, anything from you?
Yeah, like I think, Barb, this is a great question, and it kind of makes me think about the focus for this funding program on partnership development and building partners that are outside of the health sector. And where we've seen some of the really strong successes with past funded projects have been with those that have engaged partners in their communities that are involved, like in the food system, as an example, or in procurement policies around healthy food. And I think like food is a really great example because it's not one that people often think of with mental health. Like there is so much more focus on individual circumstances, but really our access to culturally appropriate and healthy food is critical for mental health promotion. And I think a lot of schools have done so much work in the last 10 years on changing what's available in the cafeteria for students and for staff. And I know one of our projects through the innovation strategy engaged with the local convenience stores that were places where students went for walks to buy lunch or snacks on breaks, and started working with them to have healthy options available, to have these healthy choices. And there was, such a real impact and growth for everyone to be able to understand and look at the impact of food on mental health.
Yeah, that's actually really interesting, very important. That again, it may be one of those sweet spots where primary focus on food, and we've got that within the Innovation Fund as well, that being a primary focus, and with the influence on mental health. I want to pick up too on, what we're talking about is, sort of leveraging what we've called assets within Canada at the community level, the national program per se, and also the global assets, including the most recent position statement that Emily and her colleagues have developed. I mean, those of us who, and I'd say this probably is most on the call, also know that, there are windows of opportunity for advancing different agendas and areas of focus. We've mentioned a couple of times on this webinar so far, a little bit about the pandemic. I mean, it hasn't necessarily been as prominent as it could be, as prominent as it's been in our lives for over a year now. But I think it really does create a certain window of opportunity. I mean, like never before, mental health is now seen as everybody's business. That, concepts, ideas, language of, systemic issues, racism, discrimination, they've never been as much in the public dialogue. And, the essence of mental health promotion being that upstream focus to really center attention on those fundamental determinants of mental health. I guess where I'm heading with this is that, when we think about the pandemic, and with all signals now saying emerging, from the pandemic, the reopening across the country, remaining mindful that, windows of opportunity for advancing, sort of attention and investment and energy into areas like mental health promotion, that the window of opportunity is only going to be open for so long. So, I mean, reopening from the pandemic, I think fairly safe to say that a focus on, balancing budgets and, sort of the whole economic focus need to be brought back into conversations by governments in particular. And so as we're imagining reopening across the country, I wonder, Emily and Shannon, whether, you might be able to comment on, any signals you have or thoughts about how long will this window of opportunity for advancing mental health promotion stay open, and how might we keep it open? I mean, those are big questions, and I think we can maybe scratch the surface a little bit for that here. But I think that's really what we're trying to sort of navigate together, is about what are those levers that can be pushed? How can we bring what we're all involved in to help keep the focus on mental health, and particularly that upstream focus? So any thoughts on, this window of opportunity and how to keep it open as we reopen across the country?
Well, thanks, Barb. You did a really nice summary of what the current context holds for people. And I'll just put a shout out to my colleagues at the Canadian Mental Health Association. We've been leading research looking at the mental health impacts of the pandemic over time in our populations at a national level. And certainly seeing that, you know, overall, our population has seen a deterioration to their mental health, and that certain populations or groups are much more likely to report these adverse consequences, including those who, you know, live in poverty, who've experienced job loss, who are Indigenous, LGBTQ2S+. So we really want to bring awareness to the population groups who are where we're seeing these widening mental health inequities. As you say, I think there's this window of opportunity here where broadly there's an understanding that mental health matters, that it needs to be you know, in conversation. And that's why globally we're trying also to push this conversation upstream and to say, you know, what's been happening now during the pandemic is not an individual experience, it's a collective experience. The social and structural determinants of health are very much influencing those pathways for people. And so, you know, the traditional approach within Canada, within our mental health system, and in many mental health systems around the world, is one that's been focused heavily on treatment, heavily towards being a crisis response system, and that hasn't been able to meet the demand even prior to the pandemic. And so we've had for, you know, decades now a mental health crisis in Canada that we've not been able to address. And I think the current situation offers an opportunity to say, you know what, we need something new. We need to approach this differently. We need to broaden our understandings. We need to go upstream. We need to address those causes of causes and support, you know, people's mental health, identify early where we can prevent mental health challenges from progressing to mental illness, and how we can, you know, orient our mental health care systems and other health systems to address those who are in need of treatment. And that's what a population approach offers, and one that centers mental health promotion.
Awesome. Shannon, anything to add?
Sure, thanks, Barb. So for those who are interested, and I think many have seen Dr. Teresa Tam, our Chief Public Health Officer at the Public Health Agency of Canada, like she has spoken several times and acknowledges the, I think the way that equity in Canada has really been, there's a spotlight on it under the pandemic, and that the impact of the pandemic has not been felt equally across all Canadians. And she has got some really good resources on her website for that, recognizing that are, and they're available. And also within our program, the Innovation Fund, as I mentioned, we have this spirit of continuous learning, and we do take the kind of key themes and evidence and research that's compiled through the community-based interventions and through the hub, some of the studies that are done, such as the pandemic adaptation study. And this information is shared with our colleagues. And as we kind of move towards recovery, like it's acknowledged, like within mental health promotion, and I quickly sort of sped through the slide that outlined some of the protective factors across our life course. And in that approach, it's really recognized that each transition that we go through, there's an opportunity to build mental health. And there, at the same time, there's also that challenge that mental health may be impacted. So examples are when we move from becoming, move into parenthood, or youth transitioning from high school to the world of work, retiring, moving from the working world into retirement. All of these transitions impact our mental health. And now we are all looking forward to recovery, but this is another transition. So this is a time, certainly, when you're talking about a window, Barb, I think that recovery window will mean different things to many people. Sometimes kids going back to school is great to get them out of the house, but it also comes with other things. There's other concerns and issues with sending children back to school too. So I think it means so many things to so many different people. And inherently this approach for mental health and building a population model really provides that opportunity to support communities to do what is shaped best for the people that they're supporting.
Fantastic. And, you know, Shannon, I was chuckling a little bit. I think you're partly speaking as a mother of young children when talking about the back to school as well. But there are two quick things I'm going to pick up on, and then we'll bring the webinar to a close, be respectful of everyone's time. Two things I want to pick up on. Emily, I'm so glad that you spoke to some of the pandemic related research that's coming out that has a very strong focus on child and youth mental health. And Emily's been, what aren't you a lead in, Emily? But, you know, a lot of research on the impacts of the pandemic on children and youth themselves and mental health. And one of the things that the Hub has tried to supplement with this research, and Shannon, you mentioned this, you mentioned about pandemic adaptations. Well, this is where the Hub actually has focused more on its knowledge development agenda, and that is in working with all 20 projects, which has been fantastic. They've been very generous with their time and stories to share what their experience has been through the pandemic. And so far, the findings, they actually were released, some preliminary findings anyway, at our annual symposium. And what will be coming out soon is going to be some of the findings, not, you know, the overall 9 themes, but actually some of the very practical how-tos on particularly working with children and youth and in virtual environments, since that's been quite a new thing across the country. And, you know, whether we continue with even hybrid models of in-person and virtual. And so, you know, some of the pandemic related research, I think super important about, yes, the impacts on children and youth per se, and families, educators, parents, etc. And then also on what does it mean for interventions, for projects that are really working with these different groups as well. One other thing I want to pick up on, and Shannon, this is something you mentioned about, I mean, terrific to mention Dr. Tam's reports and other work. I mean, going back to my opening remarks about many doors for mental health promotion, front door, side door, back door, etc. I think that one of the things the Hub can pay more attention to is even some of the access to resources and links on our website about, you know, again, reports and resources that don't necessarily come at mental health promotion through the front door, but are providing that side door, that back door, and maybe the lead is about health equity. But I think we need to navigate that space as well, because I think we're actually a larger community than many of us even realize. So part of our job, tricky as it is to create that sort of larger sense of community and how we can potentially work together. So I am going to draw things to a close. As usual, the time flew. I want to say a huge thank you to Shannon and Emily for providing such useful information and insights. Thank you to the Hub team for attention to all webinar details. Thank you to all attending for your interest and your efforts in mental health promotion through any door. We hope you learned something new and will make connections over time, be it with ideas, concepts, people, projects, programs that will all advance mental health promotion in Canada. I mentioned previously about follow-up from the webinar, so I won't repeat that about our event brief. The immediate follow-up is yours. Feedback on this webinar will inform our approach and our priorities as a Hub serving mental health promotion in Canada. Shortly after you leave the webinar, you will receive a request for your feedback. The ask is super small, like maximum 2 minutes of your time to answer 5 short questions, yet the influence can actually be big. So sincere thanks once again, and we will now close the webinar.